The prospect of undergoing surgery can be frightening, especially when you are older and your body is not as resilient as it used to be. For seniors over 75, the risks associated with some procedures are often higher than expected. However, many people are unaware of the following. There are 5 surgeries that are best avoided, or at least carefully considered at this age. Doctors rarely talk openly about the risks, and patients often feel inadequately informed. Let's start with the reality. After age 75, the body changes in subtle but significant ways. The immune system weakens, wound healing slows down, and susceptibility to complications increases. This means that even in seemingly harmless cases, surgery can be much more stressful than in younger years. In addition to direct risks such as infection or bleeding, there is also a risk that existing chronic conditions will worsen. The first surgery on our list that should often be considered critically in seniors is hip or knee replacement surgery. Although these procedures are common and can relieve pain, they carry significant risks for people over 75. In addition to a longer recovery time, complications such as thrombosis or pulmonary embolism are common. Furthermore, many seniors report that the hoped-for pain relief is often not achieved, or that mobility is not significantly improved after surgery. The insidious thing about this is that these risks are often underestimated in routine practice. Many doctors recommend the procedure without considering the individual patient's actual resilience. Yet there are alternative therapies that can relieve pain and improve quality of life without resorting to surgery. A study by the University of Heidelberg found that around 30% of patients over the age of 75 experience complications after hip surgery, while the success rate is significantly higher in younger patients. This does not mean that every procedure should be avoided in seniors, but careful risk assessment is essential. In the next chapter, we take a look at gallbladder surgery, another procedure that often requires caution in older people. Stay tuned to learn more about the hidden dangers. Gallbladder surgery. Why seniors over 75 should be especially cautious. Gallbladder removal, also known as cholecystectomy, is one of the most common surgeries worldwide. For many patients, it can be a permanent solution to pain or inflammation. However, caution is advised, especially for seniors over 75, as the procedure carries risks that are often underestimated. With age, not only does healing slow down, but the entire body becomes less resilient. Anesthesia becomes riskier for older patients because cardiovascular disease, diabetes, or other chronic conditions increase the risk of complications. Problems such as infections, blood clots, or intestinal dysfunction are particularly common after gallbladder surgery in older people. Another problem is that not all symptoms actually originate from the gallbladder. In older patients in particular, similar symptoms can also have other causes, such as gastrointestinal problems or side effects from medication. Surgery on the gallbladder could then be unnecessary and stressful. Harvard Medical School published a study showing that seniors over 75 have a 40% higher risk of serious complications after gallbladder surgery compared to younger patients. This means that what is considered a minor procedure poses a significant health risk for many older people. In addition, the post-operative recovery phase is often lengthy and painful. Limited mobility and an increased risk of pneumonia or thrombosis complicate recovery. This can cause older patients to feel worse after the procedure than they did before. But there are alternatives. In many cases, medication and an adjusted diet can alleviate the symptoms without the need for surgery. An accurate diagnosis and a holistic view of the patient's health are crucial before recommending surgery. If you or your loved ones are considering gallbladder surgery, you should always seek a second opinion and consider conservative treatment options. Carefully weighing the benefits and risks is especially important in old age. In the next chapter, we will discuss heart surgery, which many seniors over the age of 75 should avoid or at least consider very carefully. Stay tuned for important information that can help you make informed decisions. Heart surgery in old age. When seniors over 75 should be especially cautious. Heart surgery, such as bypass surgery or the use of artificial heart valves, is life-saving for many conditions and can improve quality of life. However, it carries an increased risk for seniors over 75 that is often underestimated. In this chapter, you will learn why you should be especially vigilant when it comes to heart surgery and what factors play a role. The human body changes with age, and that includes the cardiovascular system. Blood vessels become less elastic, the heart works less efficiently, and the ability to recover from stressful situations declines. Heart surgery is therefore a major strain on older people, increasing the risk of complications such as cardiac arrhythmia, stroke, or organ failure. In addition, anesthesia often has a different effect on older patients, Longer recovery times and an increased risk of delirium or confusion after surgery are not uncommon. These conditions can increase the risk of further health problems and make recovery significantly more difficult. A 2019 study showed that patients over 75 are significantly more likely to require a longer hospital stay and develop post-operative complications after heart surgery. The long-term survival rate is also often lower in older patients than in younger ones. The insidious thing is that many seniors allow themselves to be pressured into surgery out of fear of pain or limitations, even though alternative therapies or more intensive medication can often achieve similar results. Individual quality of life, general health, and personal goals should therefore always be taken into account when making a decision. When talking to your cardiologist, it is important to ask exactly what the risks and benefits of surgery are for you personally. Ask about conservative alternatives, rehabilitation measures, or minimally invasive procedures that may be more suitable for your age and health. Remember, not every heart surgery needs to be performed immediately or at all. Sometimes it is better to opt for gentler methods and support the body with medication and lifestyle changes. In the next chapter, we will discuss spinal surgery, which should be considered with caution, especially in older people. Stay tuned to learn more about the risks and alternatives. Spinal surgery in seniors. Understanding the risks and alternatives. The spine is the backbone of our body. It provides support, enables movement, and protects the spinal cord. However, with age, pain, signs of wear and tear, or disc problems often arise, which are frequently cited as reasons for surgery. Spinal surgery should be carefully considered, especially in seniors over the age of 75, as the risks and stress involved are considerable. Bones and discs change with age. They become more brittle, muscles weaken, and nerves become more sensitive. Spinal surgery is a major procedure that requires a long healing period. Older people in particular often have difficulty recovering from such surgery, which can significantly impair their quality of life. Studies show that complications such as infections, bleeding, or nerve damage occur significantly more frequently in spinal surgery in older people. In addition, the risk of repeat surgery increases because the healing process is slower and the body is less resilient. It is therefore not a decision to be taken lightly. The insidious thing about many spinal problems is that they do not always require surgical treatment. Many types of pain can be improved with targeted physical therapy, pain management, and gentle exercise therapies. Modern minimally invasive procedures also often offer a good alternative to open surgery and are gentler on the body. A study published in 2020 by the Mayo Clinic showed that patients over 75 who tried conservative therapies before surgery often achieved results similar to those who underwent surgery, but with significantly fewer risks. This means that patients and targeted therapies are often a better choice. If your doctor recommends spinal surgery, you should ask exactly what alternatives are available and what the specific risks are for your age. Take your time to make a decision and seek a second opinion if necessary. Prevention is also important. Regular exercise, back training, and a healthy posture can help prevent many problems and strengthen your spine, even in old age. In the next chapter, we take a look at intestinal surgery in seniors. Find out right here what risks it involves and when you should choose other options. Intestinal surgery in old age. Recognizing risks and weighing them up better. Intestinal surgery is one of the most common surgical procedures, especially in older people. Whether due to diverticulitis, tumors, or other diseases, intestinal surgery can be vital. However, for seniors over 75, the procedure is associated with increased risks that are often overlooked. In this chapter, you will learn why you should weigh the pros and cons particularly carefully before undergoing intestinal surgery. As we age, the body's ability to regenerate deteriorates. Wounds heal more slowly, and the immune system is less effective. This increases the risk of complications, such as infections, suture problems, or intestinal obstruction. Problems such as thrombosis or pneumonia are also more common after surgery, which makes the recovery phase more difficult. Many seniors also suffer from comorbidities such as heart problems, diabetes, or kidney failure, which further increase the risk of surgery. The combination of a stressful procedure and a weaker general condition can lead to a longer hospital stay and a reduced quality of life. There is also a risk that bowel function will remain impaired after the operation. Disorders such as incontinence, chronic constipation, or reduced nutrient absorption are not uncommon and can significantly impact everyday life. Comprehensive preparation is therefore important. Before the operation, you should discuss all risks with your doctor, consider possible alternatives, and optimize your general health. In some cases, medication or endoscopic treatment can avoid or at least delay surgery. A study by the University of Freiburg found that seniors over 75 who underwent intestinal surgery had a risk of post-operative complications that was up to 50% higher than younger patients. However, this does not mean that you should always refuse necessary surgery. Rather, you should be well informed and prepared. Care and rehabilitation after surgery also play an important role. Early mobilization, targeted physical therapy, and an appropriate diet can promote recovery and reduce complications. Get detailed information and seek a second opinion if in doubt. Also ask about minimally invasive options, as these are often less stressful. In the next chapter, we will discuss prostate surgery, which is commonly performed on seniors, but often carries more risks than benefits. Stay tuned. Prostate surgery in seniors, risks and the often overlooked pros and cons. Prostate surgery is one of the most common procedures performed on men over the age of 75. Problems such as benign prostate enlargement or prostate cancer often lead to a recommendation for surgery. However, it is particularly important to weigh up the risks carefully at this age, as the procedures are not without side effects and can severely impair quality of life. With increasing age, general health deteriorates, the ability to recover decreases, and the risk of complications increases significantly. These include bleeding, infections, urinary incontinence, or erectile dysfunction, side effects that can be particularly stressful for older men. These risks are often not adequately addressed in consultations. Many seniors report that they do not feel better after surgery as expected. The symptoms may persist or even worsen. In addition, there is often a long period of rehabilitation during which patients are dependent on support. The good news is that not every enlarged prostate or finding requires immediate surgery. There are many conservative treatment options, such as medications that can relieve symptoms without the risk of surgery. Minimally invasive procedures are also often a gentler alternative. A study from the US showed that men over 75 who underwent prostate surgery had a much higher risk of unwanted side effects than younger patients. At the same time, the benefits were only minor in many cases. It is therefore important to be well informed, discuss all treatment options, and take your time to make a decision. A second opinion can help you make the right choice and avoid unnecessary risks. Regular checkups and being aware of symptoms often make it possible to find the right time for surgery or to delay it altogether. In the next chapter, we will talk about eye surgery, which many seniors consider routine, but whose risks are often underestimated. Stay tuned to learn more. Eye surgery for seniors, understanding the risks and making informed decisions. Eye surgery such as cataract surgery or procedures to treat glaucoma are very common among seniors and are often considered routine procedures. However, people over the age of 75 in particular should not underestimate the risks and possible complications and should seek comprehensive information before making a decision. As we age, the structures of the eye change, the tissue becomes more sensitive, and regeneration slows down. While cataract surgery significantly improves vision in most cases, unexpected side effects such as inflammation, retinal damage, or even vision loss can occur. The risk is particularly high in patients with other pre-existing conditions such as diabetes or high blood pressure. Glaucoma often requires lifelong treatment, and surgery is not always the best solution. Procedures such as laser treatment or drainage surgery can lower intraocular pressure, but they are not free of side effects. Older people are more prone to inflammation and post-operative complications, which can lead to a deterioration in vision. A study by the German Ophthalmological Society showed that seniors over 75 have a higher rate of complications from eye surgery than younger patients. Nevertheless, the risks are often not adequately discussed during consultations, and many patients feel pressured to make a quick decision. Alternatives such as intensive drug therapies, regular checkups, and lifestyle changes can delay or even prevent surgery in many patients. It is also advisable to seek a second opinion from a specialist ophthalmologist in order to weigh up all the options. A conscious decision and thorough preparation for the procedure, including optimizing your general health, can reduce the risk and improve healing. Aftercare is equally important in order to detect and treat complications at an early stage. If you or your relatives are facing eye surgery, take your time, get comprehensive information, and talk openly with your doctors about the opportunities and risks. In the next chapter, you will learn more about pancreatic surgery and why seniors should be particularly cautious about such procedures. Pancreatic surgery in seniors, risks and precautions. The pancreas, a vital organ, plays a central role in digestion and blood sugar regulation. Surgery on this organ, for example, to treat tumors or inflammation, is often complex and carries significant risks, especially for seniors over the age of 75. This chapter highlights why special caution is required for such procedures. With age, the body's ability to regenerate decreases and its resilience declines. Pancreatic surgery is one of the most extensive and challenging surgical procedures. In addition to the high complication rate, the often lengthy healing process significantly complicates recovery in older patients. Common complications include infections, pancreatic fistulas, leaks, malnutrition, and organ failure. Another challenge is that the pancreas is closely connected to other vital organs such as the liver, stomach, and intestines. Surgery therefore quickly affects the entire metabolism. For seniors, this can mean that the operation puts additional strain on an already weakened organism and triggers secondary diseases. A 2018 study showed that patients over the age of 75 had twice the mortality rate after pancreatic surgery as younger patients. This highlights how critical such procedures are in older age. In addition, reduced pancreatic function often leads to digestive problems and diabetes, which can be exacerbated after surgery. The change in diet and the necessary medical care represent a major challenge that can have a significant impact on the lives of those affected. It is therefore essential to carefully weigh up the benefits and risks. In some cases, alternative therapies, such as chemotherapy, radiation therapy, or symptomatic treatment, may be more appropriate in order to maintain quality of life. Before making a decision, seniors should gather all available information, seek second opinions, and work with their doctors to develop an individualized treatment plan. Close monitoring by an experienced interdisciplinary team can help minimize risks and support recovery. In the next chapter, we will discuss bladder surgery, which is also often recommended, but is not always the best choice for seniors over 75. Stay tuned. Bladder surgery in seniors. Beware of unnecessary procedures. The bladder plays a central role in everyday life and significantly affects quality of life. Problems such as incontinence or recurrent infections often lead to recommendations for surgery in seniors. However, it is particularly important to carefully consider these procedures in people over 75, as the risks often outweigh the benefits. With age, the bladder loses elasticity and the nervous system changes. Surgery can relieve symptoms, but it also carries the risk of side effects such as urinary tract infections, pain, or worsening bladder control. Post-operative complications such as bladder emptying disorders are particularly problematic, as they make everyday life even more difficult. Many seniors report that they do not feel significantly better after bladder surgery, or that new problems arise. This is often because the cause of the symptoms is complex and cannot always be completely resolved by surgery. A study from 2020 showed that patients over the age of 75 had a significantly higher risk of hospitalization due to complications after bladder surgery. This underscores the need to carefully consider whether surgery is really the best solution. Alternatives such as pelvic floor exercises, drug therapies, or minimally invasive procedures can often help without the need for surgery. Individual consultation and consideration of personal circumstances are crucial in finding the best treatment strategy. Before making a decision, you should always seek a second opinion and take your time to weigh up all the options. After all, quality is more important than quantity, especially in old age, and that means avoiding procedures that could do more harm than good. In the next and final chapter, we summarize the most important findings and give you specific tips on how you, as a senior citizen over 75, can find the right balance between necessary treatment and taking care of yourself. Finding balance. How seniors over 75 can make the right decision about surgery. After all the information about the 5 surgeries that seniors over 75 should decline or consider very carefully, the big question arises: how do you find the right balance between necessary treatment and rest? How do you make an informed decision that protects both your health and your quality of life? First things first, every surgery carries risks, especially in old age. But not every surgery is wrong or unnecessary. It depends on your individual health, the urgency of the procedure, and your personal goals in life. Surgery can improve quality of life, relieve pain, and maintain mobility, but only if it is well planned and carefully considered. Open communication with your doctor is crucial. Ask specific questions about the possible risks, alternatives to surgery, and long-term expectations. Request clear information about the recovery time and possible complications. Don't be afraid to seek a second or third opinion. Experts from different fields can offer different perspectives and help you make the best decision. Preparing for surgery is equally important. Make sure you are in the best possible physical condition. A balanced diet, moderate exercise, and sufficient sleep will strengthen your immune system and improve your chances of recovery. Find out about the procedure and plan your post-operative care carefully. Support from family or nursing staff will make everyday life much easier after the operation. Many seniors also benefit from a holistic approach to their health. Chronic conditions, medications, mental fitness, and social support play a major role in the success of any treatment. Your doctor should consider all of these aspects in order to develop a personalized treatment plan tailored to your needs. Remember, it's your body and your life. No one knows your situation better than you do. Trust your gut, but base your decisions on sound information. You have the right to refuse treatment plans or request alternatives that are more suitable for you. In conclusion, it is not just age that counts in old age, but above all, quality of life. Surgery can be a means of maintaining or improving this, but it is never an end in itself. Set priorities, be courageous, and take control of your own health. We hope this video has given you important insights and will help you make informed decisions. If you have any questions or would like to share your experiences, please feel free to write to us in the comments. Don't forget to subscribe to our channel so you don't miss any more important health tips for seniors. Stay healthy, mindful, and self-determined. Your best days are not over yet.